Hi, so this is my smoking cessation video. I'm gonna just talk through the steps. So for the initial appointment, we begin the smoking cessation discussion. We ask about their smoking, their habits, and also review their medical history. We sure to ask the type, frequency, amount, triggers, and also if they've previously tried to quit. We advise the patient to make permanent lifestyle changes with specific advice that we try to provide for the patient to try and change their behavior. We assess also the patient's readiness to change. In regards to that, there are 5 different types. So there is the contemplation stage, which they're adamant about changing because it's a behavior that they are so used to and that they possibly enjoy that they could feel like they're losing something from them and not really gaining. The patient assesses their barriers, their time spent, hassle, fear, but they might not be exactly ready to. The preparation stage is that they're prepared to make a specific change. They may experiment with different with small changes to determine, and then it could lead to increasing the changes so they could completely stop. The action stage, that they actually go ahead and take these steps and take it into action, and you actually see that the patients are doing really well. And then the relapse stage. Sometimes some patients, they don't follow through, or something just triggers them again, stress, to go back to their old habits. We do while we're doing this, we are basically also seeing if the patient's ready to quit by using the motivational interviewing techniques. We go based off of on a guide, and then we assist the patient in the plan of action if they do seem like they want to go ahead and quit. We give them specific materials and specific referral information for smoking cessation programs or self-help services, such as telephone quit lines or websites. It's also in this stage that we provide them with a quit date where we will follow up and see how it is that they're doing. Also, we go ahead and we arrange a follow-up with the patient, so that way that would go with the quit date, to see how it is their progress is going. The follow-up date would be 1 week after their quit date, so we could follow up with them and see. We could also provide them with different type of references to see if they need any additional help. But honestly, in regards to tobacco, a lot of patients are not ready to quit. Even if they're not smoking, they have like the little tobacco that they could chew. So you just have to see how the patient is, if they're willing to go ahead and proceed.